daughter had surgery last Wednesday on her eyes, and had no complications. Last night, she hacked up a bunch of what looked like old blood. She's medically complex, so she does weird things, and she hacks up a lot of white mucus, but not normally blood. But I thought, well, maybe she had a bloody nose or something, and since she was laying down, we didn't see it or something. I didn't think much of it because she seemed herself otherwise. She did that again this evening, though, and I don't see any signs of, like, bloody nose problems all day today. She's, like, just normally like she does. She's hacked up stuff, and it's just been white mucus during the day today. At 4 p.m., I checked her G-tube to see, like, what gastric contents I could pull out, and it was just white, like, clear stomach juices. And so I thought, that was just a one-off thing. But then again, this evening, she did that. My husband checked her G-tube for, like, stomach contents after that, and there was old blood in her stomach. So I don't know if it's coming from her lungs, and then she swallowed it, or I don't know.
Yeah. So just to make sure I'm following the story correctly, you guys have seen some of that old blood 3 times now?
Well, twice that she's hacked it up, and then my husband, I said, check her G-port and her J-port, and when he drew back on her G-port, there was old blood stuff in her stomach, but not in her J-port. Okay. But that was right after she had coughed up stuff, so I don't know if, like, it came from her lungs and she swallowed it, because at 4 p.m., at 4 p.m., I checked her stomach just out of curiosity. I'm like, you haven't hacked anything up all day. Is there blood in your stomach? And there wasn't.
Okay. And about how much, if you had to guess, are you seeing? Is it like a large amount or like just kind of streaking?
I took a picture of it, and it's like bigger than your fist puddle on a cloth.
Okay.
I also suctioned up quite a bit.
And then my husband said he suctioned up quite a bit. So you think it was like 100, 150 mils of phlegm?
It might be close to that, maybe.
About 100, 150 mils of phlegm. It's not red. It's like brown tinge. There's not really like a lot of coffee ground specks or anything. It just is very like old blood tinged.
Yeah. Okay. So not super bright red, but that's darker color.
Yeah.
Okay. And how is she acting otherwise?
Completely like herself.
Completely like herself.
Like I said, she had eye surgery a week ago, and Botox injections. She's been off antibiotics she had a surgery spinal infection. She's been off antibiotics for a month. Nothing else has changed.
Okay. And otherwise, tolerating feeds like normal.
Yeah, and she pooped yesterday, a normal bowel movement. She hasn't been pooping like quite as much as normal, but like I said, yesterday she pooped a normal bowel movement, and she doesn't have like a distended stomach or anything.
Okay, those are all good signs. And I'm looking to see if she does Kate Farms.
Yeah, she's not,
formula.
As far as I know, she's not taking any of the stuff that was recalled. I know there was a recall, and that's not her, like the lot number and the expiration dates of what we have is not that formula.
Okay. And I'm just looking at her med list. She does omeprazole.
Oh, okay, that's another thing. So omeprazole gets mailed to us, and sometimes it's tricky to order it on time, and she has not had that for 5 days because, she got it today.
Afterwards.
She got it tonight, but
that was after she did that.
It was after she puked up blood, because it's a compounded med. They have to mail it to us, and it had to do with when we were out of town, and when the weekend fell, she did miss omeprazole for 5 days.
Okay. And she's been on this for a while, I assume.
Yeah, and she's had to miss that medicine is a pain sometimes to get on time. She's had to miss it sometimes for like maybe 2 days in between scripts, but that's the longest she's ever gone without it. I don't feel like she seemed like she had reflux or stomach issues, besides whatever this is. But yeah, she has been off her omeprazole, except for she got her dose tonight, but...
Okay. Yeah, so, I'm not sure that explains everything. There is an element of what we can see rebound in that medicine. So if we have a patient that's been on it for a while and then it's kind of stopped suddenly, we can see that rebound effect. Now, like I said, maybe that doesn't explain everything, but, it could be that mixed with, some type of small little trauma somewhere along the GI tract that, together has resulted in this picture. Everything else you're telling me is very, reassuring.
Right.
That it seems like it's older, darker color. She's very much acting herself, tolerating feeds.
Do you think it's from her lungs or her stomach?
Yeah, so good question, and it may be hard to be able to completely say, but if I were to have to guess, I would say it's probably from her stomach.
Even though at 4 p.m. she just had like clear gastric juices this evening.
Yeah,
okay.
And it could just be, I don't know, so many factors, timing, where from the stomach, the juices and stuff was being suctioned, so many things. But typically, and sometimes there's even kind of small, insignificant trauma in our mouth, whether, there's a tongue bite, whatever it is, and then that blood is swallowed.
I feel like we would have seen that.
Yeah.
I feel like we would have seen, like, she doesn't swallow great. I think if her mouth was bleeding, we would have seen evidence in her mouth or, like, around her mouth. And, like, she doesn't handle her secretions well, but, like, she starts to cough on them, and then we have suction available all the time, and she's only coughed up, like, white, frothy mucus all day today, which is what she normally does. Like, no blood tinge whatsoever in it until this evening.
Yeah. Yeah, no, I hear you. And like I said, it is hard to pinpoint exactly, with certainty where it's coming from. But what we can say, she sounds like, it's not like an active bleed, and she's stable. Now, please don't hesitate to call back if this returns or it changes to the extent
it's like
that it's
red blood or something.
Bright red. Yeah, like bright red. We feel like there's more of it. It's brighter, like it's currently happening or an active bleed.
Tomorrow she has an appointment at Children's with neurology. Would it be possible that like pulmonary or GI would want any sort of x-ray since we're headed there anyways? Or labs?
Yeah, good
or
question.
Who would you recommend I would call in the morning?
Yeah, good question. If she, outside of this, doesn't have any more symptoms, I can't think of any imaging that's going to be useful. Like a chest x-ray or abdominal x-ray isn't going to show me anything.
What if she does this again, like, tomorrow night? What if every night she's having, like, one coughing fit of old blood?
Then I think that becomes a conversation of whether there's some, like, gastritis or irritation along the stomach lining that we just need to kind of improve our medical management of. But really that omeprazole or that acid-blocking medicine
might be what could be
what we would use for that.
Okay. All right. Well, thank you so much.
Yeah, no problem.
Okay. Have a good night.
All right. Yeah, you guys too.
So she's not overly concerned, or else she would have said to take her to the ER.
If we saw red blood, we should just go ahead and head to the ER. Yeah.
Hey, so I wanted to do a quick wrap-up of all that.
That all happened last week one day. Basically, Raelynn spit up some old blood. That happened 2 days in a row, and we fully expected them to tell us to take her to the ER. But it was comforting to know that they didn't seem at all concerned whenever we called. And even the next day when Raelynn had a doctor's appointment, nobody really seemed concerned to x-ray her or do any kind of tests whatsoever to find out exactly what it was. The fact that it was old blood means that she wasn't currently bleeding. She didn't have an open sore somewhere within her. And it only happened those 2 nights, and then ever since then, she's been completely fine. Like we said in the video, there was no other symptoms. She didn't have a fever. She didn't seem fatigued. She was just her normal self. So they weren't concerned. Really, it seems like it came down to she had surgery a week before this. And as we were thinking about it, one of the surgeons even said that there was possibility that irritated the lining of her esophagus. So maybe that's what it was. Maybe there was a bleed, but then it healed. But then she coughed up that old blood. But at this point, everything's fine. Raelynn's fine. That's not happening anymore, and we're all good. So no reason to be concerned. No reason to worry about her in terms of all that. She's doing just fine. So little scare. These things happen from time to time with her. Sometimes we have to just call and see what somebody else's opinion is. But in the end, everything was just fine. Always good to get it checked out, though. Anyway, hope that was instructive to you in terms of the process that we oftentimes go through when Raelynn has some kind of medical mystery to us. Even throughout that process, we never lost hope. And I hope that no matter what's going on in your life, that you always have hope also. Hey, if you want to see another medical mystery that we went through, check out that video right below me. Like I said, Raelynn goes through these kinds of things from time to time, so there's always a mystery about her. So watch that video next, and take care.